Today, I would get you to know what is counseling. What are the various types of counseling in a psychology? So before that, you know what is counseling. It's a series of contacts between counselor and client to get change his behavior and attitudes. So it's a simple one to understand what is a counseling. But if you want to know how the counseling process takes place, what are the various methods to take counseling process, we have traditionally a concept called directive counseling or prescriptive counseling, which was proposed by E.G. Williamson. Directive counseling, where the client is illiterate, not matured, where he couldn't have enough information to take his own decision. For this reason, the counselors, having a professional one, would give the proper information, proper decision making, proper tips to get into that problematic situation. This is also called uh, counselor-centered therapy, where the counselor plays a key role rather than the client. The merits of this counseling process is it is less time consuming, it is based on intellectual, it's very economical. Through this counseling you can consult many people, and it is a easy and ready-made mode of counseling. But there are some demerits of this counseling also. The few demerits of this counseling, it's a counselor centered. Here client is passive, and moreover client can evolve with a new maladjustment, with a new adjustment problems, because client loses the integrity, the independency, the autonomy to express his views. In this counseling we are focusing on intellectual aspect, not the emotional one. You know, well, most of the counseling sessions of clients is based on emotional trauma, emotional instability, or like a maladjustment, or a lack of adjustments towards such a certain situation. Here we are focusing only on the intellectual basis, not on the emotional basis, which is one of the crude demerit of the counselor-centered counseling. And but it is also said that it is a very traditional way, and unprofessionals and untrained people only take a counselor-centered counseling, where counselor is not at all trained and client is immature. So the counselor with his experiences and with his ideas, he would guide the client. As you all know, how the teachers, our parents, our elders, and even if you're going for career counseling or any other counseling which is related to taking information, you'll find there that person is very active rather than you. You just listen to their words, and you just nod your head without giving your ideas, without giving your insights there. So I think it is one of the traditional way of counseling. But if you're trained and a professional counselor, always use non-directive counseling, which is also a client-centered counseling. But does it mean that we need to use only non-directive counseling if you are a trained counselor? No, not at all. Because counselor-centered counseling is only for the certain fields where the clients are not able to get into their information. For example, if you are going to schools, client-centered counseling doesn't work there, because children and the adolescents, students are very confused with their life. So you need to guide them, you need to give the information, you need to educate them. For that you need to use counselor-centered counseling. Whereas if you're counseling a middle-aged group, or if you're counseling a family, then you need to use client-centered rather than counselor-centered counseling. So you're clear with the, I think you're clear with the counselor-centered counseling, which was uh, proposed by E.G. Williamson. The second one is client-centered counseling, which is proposed by one of the eminent psychologists called Carly Rogers. Here, the emotional stuff is focused than the intellectual one. The client is very active, whereas the counselor is just passive. He just go on listening what the client is saying, and he shows only empathy rather than showing the sympathy and giving suggestion to them. Here, insight is built when you're taking about the problematic situation. And in client-centered theory, the person is independent, is have some sort of like a he has some sort of integrity, independency, autonomy to express his views. So client-centered is very popularized in present area, because here the client is free to choose his own decisions when he gets some sort of idea or some sort of clarity. So if you want to take steps for how the counseling process goes with the client-centered and counselor-centered, these are the few steps you need to follow when you're doing with the client-centered or the counselor-centered. If it goes with the counselor-centered, the first step of doing counseling is to analyze the problem. Then you need to synthesize the information through psychometric assessments or through data which you are getting from the client. After doing analyze and synthesizing to diagnosis, what is the reason for it? And then you need to prognosis. Prognosis means getting idea how to treat, or that it's a planning to planning for a treatment. Prognosis. And next you do counseling. So the treatment, the therapies you will apply to a client. And last you will follow. What are the things you have missed? What are the things I have got? What are the things I have followed during the counseling sessions? Whereas in client-centered, the steps are a little bit different. In client-centered, you are the first step of going to counseling is like first the client he will explore the problematic situation. After that, he will build some sort of uh, expressions which are negative and positive. You want to differentiate what are the negative feelings and positive feelings. When he's like talking, when he's speaking, suddenly you get a flash idea. It is called insight. So building insight in a client-centered counseling is very important. After that, after building the insight, you will choose the best strategy to follow up that insight by planning, setting goals, forming a strategy, and action plan. At last, the counselor could make the client himself to take his own decision rather than depending on the counselor. So these are the steps where client-centered and counseling-centered counseling takes place. But I have a question. Should I follow only this type of pattern when I'm doing counseling? Not at all. There is another way of counseling called eclectic counseling, which was given by Tanvi. These psychologists given emphasis not choosing only one approach, but choosing the best one which takes place with the client situation. You know well, the same client is at a different time having a different situation, make a different sort of approach during the counseling. So for the same client, there's a different times where you can't choose one type of counseling, like client or counseling center. So you better use eclectic type of counseling. If a student comes to you, I'm some sort of stress. First, you do rapport building. You build like a client-centered counseling, and you will get the information. What are the reasons, and what is the emotional instability? What are the reasons for this emotional instability? After that, you give directive counseling, where you will give suggestions, guidelines, how to cope with the stress, how to study, what are the memory tips, all these things. So this is a way of a best counseling process. But unfortunately, in most of cases I've seen, even the best psychologists also they're using only direct counseling, where the client is totally dependent on the counselor and is building a new adjustment problems also. So if you want to become a great counselor, use eclectic way of counseling, where the one fits in a right way to the client's perspective. And these are the types of counseling you will take. These are types of counseling. I think you are clear with the directive counseling, non-directive counseling, and eclectic counseling.